Welcome, everyone. We've got an amazing guest today, Nicole Bukovinski. She is the product manager for AMSL Regenerative Medicine division. I've known Nicole since 2015, and that's when I have introduced PRP treatments into my practice. Welcome, Nicole.
Thank you, Sophia. Always a pleasure to talk with you.
So let's start in regards to PRP and what PRP is all about. How long the PRP has been used, and what areas of medicine PRP is used in?
Sure. So the concept of PRP has been around since the 1970s, was first used in the field of hematology. Now, the first case was an open heart surgery case back in the 1980s. And then since then, 1990s, right up to 2000, we've been using PRP in surgery for reducing inflammation, increasing new cell turnover, less downtime for the patients as well. Then in functional areas of PRP application is your musculoskeletal medicine, your gynecology, maxillofacial surgery, ophthalmology, aesthetic medicine, cosmetic, and also that includes hair.
Oh, wow. It's quite interesting because, most of people don't actually know the history behind it and how, PRP, it's all started. So let's talk about what actually PRP is. What exactly?
So PRP is an autologous. Yeah, exactly. What PRP is an autologous product, meaning it's from the patient's own blood. And it's characterized by a higher platelet concentration than a patient would have, at baseline. To date, there's no universal accepted definition of PRP. Clinical publication by Professor Robert Marks back in 2009 had a lovely simple definition. PRP is a volume of autologous plasma that has a platelet concentration above baseline.
Oh, wow. There's so much, information when it comes to PRP. One of the things that my patient do ask me in terms of, being the right candidate how can they get ready for a PRP? Is there a do's and don'ts? If there's any contraindications that you're not allowed to do the PRP, I think it's quite gray area, and I think people will be quite interested to hear.
Sure. What we need to remember, going back to this being an autologous procedure, what we're taking out was simply harvesting and injecting the plasma back in. So it's very important that the patient is at optimal health, not recovering from a cold or flu, not recovering from cancer therapy, being at great health. So that would be being mindful of their internal nutrition, making sure they have great antioxidants in their system, whether it be through supplementation or diet. Yes, there are many contraindications, and it's all around the quality of that patient's platelets, if they are viable to then activate and release their growth factors. Now, that's why it's very important for a PRP procedure for the patient to have a consultation with you to rule out anything that would compromise their results.
Thank you, Nicole. Just wondering also, in terms of patient expectations, what would a patient expect to see and feel from the aesthetic skin PRP procedure?
Yes, so PRP, it generates tissue integrity, improving your skin turgor. Also, platelets will activate and release their growth factors. All of the growth factors have numerous different jobs, some of them being stimulating new blood supply to the area, improving pigment within that tissue, stimulating the ECM, which is the extracellular matrix, which is stimulating more hyaluronic moisture into that tissue, so hydration improves. Also, what PRP was indicated for initially was skin laxity, crepiness around that periorbital rim, laxity on that submalar area of the face, skin laxity of your necks, your décolletage, body bits, post-baby tummies. So PRP will stimulate the patient's hyaluronic, the collagen and the elastin in that tissue.
Oh, fantastic.
Now, just to support that, there's a huge body of evidence now, finally, after all these years coming through for aesthetic application. One that comes to mind is a double-blinded split face comparing PRP and saline injected back into the skin tissue. This was published by JAMA, which is a dermatology peer-reviewed journal. And they recruited 19 patients, Average age was 46 years of age. PRP injected just into that skin tissue, so the upper area of the face. Patients assessed themselves at 2 weeks, 3 months, and 6 months. Patients saw a statistically significant improvement in the skin texture, the pigment, new blood supply into that area as well. As with the dermatologists, also assessed these patients' results by way of before and after images. Dermatologists saw other improvements, and that would be the fine line improvement, pigment again, the roughness and the sallowness of the skin tissue as well. So that's very pleasing to see that the future does look great with a natural, bespoke, preventative, non-surgical procedure such as PRP.
Amazing. Thanks, Nicole. It's so informative. Would you agree that you have to be selective in terms of your patients, and the results might vary depending on their lifestyle, their nutrition? What are the things do you think people can prepare for a PRP in order to get that ultimate result? And as an injector, you want to give them the best results that they can get when they come in. How do you think we can prepare our patients in terms of providing the right information so they can get the optimal results?
Great question. And it's about reminding the patient this isn't a product we're simply taking out of a box and injecting back in. We are relying on the patients to be accountable for this procedure, ensuring they are at optimal health. If they've just recovered from a flu, or if they have been run down or unwell for some time, really pull back, really invest in their health and their nutrition for at least a month, even up to 3 months, to make sure their system is at optimal health by way of your amino acids into the system, the antioxidants that we discussed prior, and a clean diet would definitely improve their results.
I couldn't agree with you more, Nicole. And the last question, just to wrap this up, in terms of the longevity, everyone's asking me, how long does the PRP last?
Good question. We are asked this question quite a lot. Again, bring it back to this being a natural autologous procedure. What we are simply doing is initiating that wound healing cascade, stimulating all of the jobs that these growth factors have within that tissue, one of them in particular being producing collagen. That conversion of collagen and that remodeling phase of the wound healing cascade, that's a long process. That can take a good 12 months to lay down some good collagen. So once you've had your first PRP, it doesn't go backwards. It continues to improve and get better and better after even 12 months after their first 3 sessions of PRP. Commit once a birthday, have a celebration PRP procedure to ensure that you won't go backwards, that you will continually slow down that aging process of the skin tissue. So the short answer is there's not a set time where it runs out. It doesn't run out. The skin tissue will continue to thicken, grow your collagen, your elastin, your blood supply. Just top it up every year to maintain that and continue to get your improvement.
Fantastic. Beautiful. I do enjoy having PRP as one of my treatments, and I must admit that having that holistic approach in my practice, PRP is probably one of the most popular treatments, and are absolutely loving doing it. And, obviously taking consideration patient selections, and, giving that, realistic expectations to the client, as you said, in terms of the comparison, with other products, as it is a natural way of stimulation of the collagen production.
Absolutely.
Beautiful. Thank you, Nicole, so much for taking time, coming on
Absolute
board.
pleasure.
You have a wonderful day, and I'm hoping
Thanks for
you're
having us.
staying strong in this, lockdown, and I'm looking forward to seeing you face to face when this is going to be all back to normal.
Absolutely. Pleasure. Thanks so much.
Thank you so much, Nicole.